Hi, everybody. Thank you so much for joining us today. I'm Jamie Morocker. I am the network health reporter for Global News. So that kind of means that I cover all things health, medicine, and science right across the country. Today, we've been brought together by the Lung Health Foundation to talk about a topic that is likely to become ingrained in every aspect of our healthcare system if it hasn't already. That, of course, is digital health. So we've handpicked a group of very qualified experts for you to hear from, four guests that I am very pleased to welcome. So we are going to begin with family physician, Dr. Mohamed Alarakia. Dr. Alarakia is no stranger to digital health. He is the managing director of eHealth Center of Excellence. He's also the digital health and innovation lead at McMaster University and was awarded the Digital Health Executive of the Year Award in 2019. Next up, I would like to welcome Ava Mindapur. Ava is a PhD candidate at the School of Rehabilitation Science at McMaster and is currently examining the validity of virtually administered mobility assessments for older adults. Next, we have Sheila Maloney, the Executive Vice President of Engagement and Marketing at Canada Health Infoway. In 2017, she received the inaugural Women's Leaders in Digital Health Award, celebrating the top 10 female visionaries who are harnessing the power of IT to transform healthcare in Canada. And last but not least, we have Dr. Irving Mayers. Dr. Mayers is a professor of pulmonary medicine at the University of Alberta and is the medical advisor to the provincial oxygen program. He also runs a very interesting pilot project testing the boundaries of digital health. And we're going to talk about that a little bit later. But first, I want to welcome all of you. Thank you so much for joining us. Thank you for being here. Now, if you weren't aware before the pandemic, the last 2 years has certainly thrust digital healthcare into the forefront. From telemedicine to contactless research to data collection, even AI and machine learning, there's no doubt about it that digital healthcare is here to stay. But it doesn't come without its issues, whether that be privacy or ethical fine lines. And we are going to discuss all these things here today with our roundtable. I want to first start off with Dr. Alarakia. Can you tell us a little bit about the opportunities that come along with digital healthcare first off?
Yeah, thanks very much, Jamie, for that great introduction. And I think you really shed light on the fact that we have done a tremendous amount of things in digital health over the last couple of years during the pandemic. And it really has accelerated some of the opportunities that we have, whether it is connecting with patients remotely and assessing them for COVID, or getting them out of hospital sooner because we can monitor them in their homes. I think we've seen a lot of benefit. One of the great opportunities is to leverage the information and data we have to automate more things in the health system. So, while we know that information systems have had tremendous benefits of digitizing data and having it available, and ultimately allowing patients to see data, we know that they are causing tremendous burnout in clinicians. Clinicians are struggling with information systems. Some are retiring early because of that. And so we really need to make things easier for clinicians by leveraging these information systems, which we really haven't been able to do up to this point. And so automation allows us to do that. It really takes the repetitive routine processes and it leverages what are software robots. So not walking, talking robots, but robots that digitize the mundane processes, and it does it for the clinician. An example of this is where there was a robot that was deployed to support COVID vaccination. It saved a group of 10 clinicians 87 hours of time. And so that allowed them to see their patients and not focus on entering data in the information system. So, I think we really have an opportunity to leverage the data to automate more things. And you mentioned artificial intelligence. Can we get algorithms to suggest things? Now, I'm a family doctor, so I don't think the algorithms are going to replace me, hopefully, but they really could support my decision making, whether that's through artificial intelligence or more decision support. Can they allow me to understand which patients are at risk, which patients, for example, need immunizations? And we've seen that we've been able to do that successfully. We've been able to increase immunizations for pneumonia, for influenza, by 18 and 19% respectively for chronic diseases, just by leveraging digital health and bringing that to the forefront to clinicians and their staff. And finally, I think in terms of patient access to data, I think that is a tremendous opportunity which we haven't realized yet. Patients need their information. They need to understand what's happening with their healthcare. They need to provide their input and feedback into their healthcare. We've seen, for example, with surveys and assessments done on tablets, and that was obviously pre-pandemic, that patients feel more comfortable, putting in things like suicidal ideation into surveys, which can be very difficult. Even in my own experience in my clinic, I've had a patient who was able to communicate that he was suicidal, and then we were able to follow up on that leveraging technology. So technology can be an enabler if it's implemented in the right way for both patients and clinicians.
You brought up a really good point there about patients having access to their information, but with that comes perhaps companies having access to the information, and a major, I don't want to say issue, but there is that major issue of privacy when it comes to our healthcare data. We know that health data is digital gold. If it isn't now, if it isn't considered that right now, it's definitely going to be down the line. So I want to turn to Dr. Mayers now, because you actually implemented programs yourself and you saw some successes and failures when it came to this sensitive info. So can you tell us a little bit about those?
Sure. About 15 years ago, we tried to develop a program to help patients with difficult to treat asthma. That normally people get what's called an asthma action plan, that is a piece of paper that explains what to do with their medication if there's symptoms or lung function changes. We put that sort of living action plan on a server behind the Alberta Health Services firewall, and people could enter their symptoms, enter their lung function, and a simple algorithm would suggest what to do next. At the same time, there is a nurse specialist in asthma who would oversee a lot of the results and would just check up on people as they'd enter their data. Individual patients loved it because it was hard to track down where that piece of paper was with your action plan, and going online was simple. They could be anywhere in the world and access this. Unfortunately, at that time, it was almost impossible to get the privacy commissioner to sign off on this, even though we worked with them closely. It was just not possible to safeguard the information in a way that met all the rules and laws of the day. Today, it might be easier with some of the electronic medical records that exist and already have dealt with privacy concerns, but those have their own issues.
You're absolutely right. They do come with their own issues. And if we're looking at Canada or the US, we know that data privacy hasn't kept up with how fast innovation is taking place. Perhaps in Europe, it is a little bit better, but I want to turn now to Dr. Maloney, and maybe you can give some insight to this. When we're talking about privacy specifically and a policy behind these digital tools, can you tell me what needs to be done to make them safe at a policy level and make them so the patients feel as if or can be assured that their privacy is guarded? And can you also talk about the obstacles that we may see when it comes to that?
Yeah, it's a great question. And we do annual tracking surveys. So we go out to Canadians every year and we ask them what their attitudes and perceptions are of digital health. And it's interesting, we did probably the largest public consultation around digital health. It just completed in February 2020. So it was about 58,000 Canadians. We had a number of different engagement mechanisms by which we surveyed them. We had focus groups. We had one-on-one interviews with vulnerable and marginalized populations, Indigenous focus groups, so a very wide gamut of people that we connected with. And so we asked them what they thought about it. And privacy concerns were the number one issue, and they have been for years. But what's interesting is, and Canadians told us that they want access to their health information. They want to be able to share it with the clinicians and people in their circle of care. They also told us they would be comfortable sharing it with private sector and researchers if it meant helping somebody like me, address a condition or something that they had. They also told us that they wanted people who took advantage or who abused that confidentiality to be punished to the full extent of the law. And it was interesting. So again, I said we finished this consultation in February 2020, and then COVID hit. And so we thought this was a really great opportunity. So we had this pre-COVID research and information. And then what we did is we went out in the spring, mid-COVID, in spring of 2021, and we resurveyed Canadians. And two things changed from the first, well, three things, I guess, from the first survey. First of all, many more Canadians had experience with virtual care. Obviously, we went from, maybe 4% of Canadians had virtual visits prior to the COVID to probably the total opposite. We made more progress in a year than we had in decades. So people had more experience with them. And they told us two things that were different. They were more comfortable, more satisfied with their virtual experiences, and they wanted to complete that. So they wanted a digital first experience, not only digital, but there are circumstances they recognize where they wanted to have a digital. The second thing they told us was that they were, on average, Canadians were less concerned about privacy. People who had that experience were less concerned about privacy than prior to. So I think that bodes well to Dr. Mayer's, your point about, that might change. And one of the things that I think some of the privacy legislation, and there's personal health information privacy legislation in every jurisdiction right now. And I think those are some of the things that we're seeing a lessening of, and people are really interested. But it's all about trust, right? And it's that trust that a patient has with their physician. They trust governments generally more so than private sector, for example. So I think those are the kinds of things that we really need to address. So from a privacy perspective, there's lots of other, I think policy issues that we want to look at, and I'm happy to talk about them now, or we can bring them up in a little while as well.
Yeah, so I'll actually get you to dive into those a little bit more, because what exactly are the issues with the policy and what needs to change maybe right away to make people a little bit more comfortable, even though you're saying that you found that they were maybe more comfortable. We still know that privacy laws haven't really kept up.
Yeah, for sure. And maybe I can give you a bit of an example of some of the things that happened during COVID. So for those who don't know, Canada Health Infoway is, so our mandate is to increase the, health of Canadians through digital health innovation. So we work with the jurisdictions, the provinces and the territories, and we implement digital health solutions. So when COVID hit, we went to each of the provinces and territories and had, weekly, daily calls and said, what do you need? And they identified four things. They needed to make sure that clinicians could actually do virtual visits because they couldn't see their patients in person. They wanted to be able to monitor their patients remotely. They wanted to be able to increase in mental health services in jurisdictions because we know that was such a big impact from COVID. And they wanted to be able to access their lab results and share lab results with their patients. And so, in 45 days, we implemented and invested in 17 projects across every single jurisdiction. And the mandate was we had to have those things up and running in 30 days. And so when you think about what enabled that, there was a singular focus. There was some softening of some of the privacy restrictions. There was enhanced decision-making and rapid policy changes. And I think those are the kinds of things when you think about what policies have to change. And we also did a major initiative where we had regional roundtables with stakeholders, clinicians, governments, patients, and we asked them what their issues were and where we could go from here. Lack of infrastructure was one. Misaligned funding models. So in terms of policies, one of the big drivers for virtual care was that the funding incentive models changed. Historically, physicians weren't being paid for doing a virtual visit, or they weren't being paid, they didn't see the value in doing it. So when you change that investment incentive model, that changes the behavior. So that was a big issue that I think from a policy perspective is going to be very useful. And then there's things around, education and training. So I think the big policies, around privacy and around the aging workforce and the restrictive, and then the funding incentive models. Those are the two biggest policy drivers that I've seen that have been helpful from advancing digital health in Canada.
This will come up again during the discussion, I'm sure, but I want to get to Ava quickly. We know that e-health is a game changer for a lot of people. Say you're pregnant and you don't feel comfortable during a pandemic leaving your house. You could have a virtual visit. If you have mobility issues and you can't leave your house easily, or the doctor's office isn't accessible, perhaps this is a good trade-off. And I know, Ava, that you have a deep background in this. So can you tell me a little bit about how digital healthcare has maybe helped those who have issues going into the office, and talk about the reliability of e-health as a whole, maybe?
Yeah, that's a good question. So I think digital health technologies can be very useful in some circumstances. It was mainly pushed, these research projects that we were conducting was mainly pushed with the COVID-19 pandemic to get more perspective of the reliability and validity of digital health technologies. The benefits are, again, immense in some cases for older adults and individuals with chronic conditions. Individuals with chronic conditions like COPD have reported that mobility is a huge challenge and a huge area of life that's important to them, for them to improve that. So we know mobility is a barrier in general, walking about in their environment, in their homes or outside. And this poses as a challenge to access healthcare services, or going into clinics, for example, or healthcare facilities and receiving these forms of care. And digital health technologies can improve that access to care, whether it's older adults living in Southern Ontario, or we have other remote communities throughout Canada who may not have the luxury of having healthcare facilities close by, or a lot of healthcare professionals in that area.
Dr. Alarakia, can you talk a little bit about some other barriers outside of maybe patients not being able to access the care, but are there technological barriers as well that you can speak to?
Yeah, unfortunately, too many. We have great technologies. They don't really talk to each other, and we really haven't been bold enough to say that they must talk to each other. There certainly is work on that, and we can look to the States for a lot of work that's happening as well. And I'm not suggesting we copy them, but I do think we can learn a lot from what they've done. And I think we need to really say that we're putting our public healthcare dollars into these information systems. At a bare minimum, they need to talk to each other. So if I need information from a mental health and addictions organization for one of my patients, and I'm in the circle of care, so the privacy protections have to be there, I should be able to get access to that information. I saw a patient this morning, a young child who had, could have been a seizure, so had some symptoms of seizure, went to the hospital. I had no information on that hospital visit. And so, in this day and age, we should have that information readily available. And it does impact care that clinicians deliver and that patients get, because if you don't have the information, then you have to chase it down. You need to then connect back with the patient. You may not have had all the information there to make the right decision for the patient. So, the interoperability of systems, we need to be strong on that. If we're putting public money into the systems, they need to talk to each other. They need to allow patients to access the information. I think the other thing is, we aren't using the private sector as much as we need to, and so it is I think important to have the protections in place for patients' data to be secure. But if patients give consent to have their information used, and as we heard from Sheila, they want their information to be used to help their care. They want their information to be used to give them more personalized medicine. And we're not there yet in terms of, what is that particular patient's risk of something bad happening, and what do they need to do to mitigate that risk or to decrease that risk. So I think that's a significant barrier. I'll just go back to the patient access to information technology. I think that's a huge thing that we need to deal with. There is an inequity. There is a digital divide where patients can't access technology. We need to be more innovative in the ways that we think about that. So what about things like libraries or shelters and getting patients access to information in those institutions? It really is not just health, it's beyond health, it's health and social that need to come together. And the framework needs to be there so that we can collectively solve these problems. A lot of problems in the healthcare system are actually problems with social determinants of health that we haven't effectively dealt with, and we don't have the levers in place to actually deal with those things.
You touched on a lot of good points there, including the private sector. So I want to go back to our private sector expert, Sheila. We're talking about widespread implementation of digital healthcare and e-health. Can you talk about maybe the issues that could come along with that, if there are any, in your opinion?
Yeah, and I think, Dr. Alarakia said it, like the biggest global issue around technology and health is interoperability, is the lack of systems talking. And I think, every nation in the world is really grappling with that issue. And, we have multinational vendors, we have, Canadian vendors, we have vendors that are, in small areas or just existing in one or two regions or provinces. And so one of the things that we really need to make sure of is we're all using the same standards that allow those technologies. And there are standards in HL7 and FHIR, and so they do exist. It's making sure that everybody's using the same one and providing the incentives. And I think one of the things that InfoWay did in the early days was to say, we will help invest in these initiatives with the jurisdictions, but here's a list of conditions. You must follow these standards. Here's the de facto Canadian standard. You must comply with that standard for interoperability. You must complete a privacy impact assessment. You must do a benefits evaluation. So we have the